13Cares, the Rockford Spine Center is known for its success and impact on the medical community. Now they've discovered a new spine surgery that can drastically improve the outcome for patients dealing with spinal deformities. Rockford native Bonnie Johnson experienced spine problems firsthand and underwent this surgery. Take a look at her journey.
Bonnie Johnson started the Gymnastics Academy of Rockford in 1977 and ran it until she passed it on to her daughter Lori and son-in-law Jim in 1993. Saying Bonnie leads an active lifestyle is an understatement. She is a mother, grandmother, wife, entrepreneur, coach, pilot, and all-around go-getter. But a few years ago, her life turned upside down.
It felt like the top part of my body was too heavy for the bottom part. I couldn't stand, and that was the hardest thing.
10 years earlier, she started to have some back problems and went to see an orthopedic surgeon. At the time, his advice to Bonnie was to try less invasive measures to ease the pain and hold off on surgery as long as she could.
Unfortunately, I took it maybe a little too literally because I waited until I was in extreme pain, couldn't walk without a walker. I really couldn't stand for more than 30 seconds at a time.
The woman who once paraglided in Europe and jumped off a mountain in Switzerland was forced to spend her days in bed. When she couldn't stand the pain anymore, she turned to Dr. Fred Sweet at Rockford Spine Center for help.
She came to our clinic in a wheelchair. She had a very crooked, deformed spine. They'd gone to a point where every time she'd stand up, she'd put a tremendous amount of pressure on one of her nerves.
Bonnie suffered from scoliosis, kyphosis, and degeneration of the spine, conditions that she could have been born with and worsened as she got older. This photo shows Bonnie at the height of her pain trying to stand up straight. Some mild deformity is normal with age. Bonnie suffered from an extreme case.
Vertebrae are actually tilted, and that's what was compressing the nerve. And the only way to relieve her nerve pain was to actually straighten up the scoliosis and the kyphosis.
Historically, the surgery to correct these conditions is very complex, taking 8 to 10 hours, and often comes with high complication rates. However, in 2005, Dr. Sweet developed a new technique called Transforaminal Anterior Release that is showing promising results for patients.
We have a much shorter operative time and a lot lower blood loss. Our patients don't have to go to the ICU. They don't have to be on ventilators. They can eat right away. We get them out of bed right away. So the complication rate really falls off dramatically.
By going through a disc instead of bone, Dr. Sweet has managed to shorten operative time and blood loss. Dr. Sweet has shared his new technique with colleagues at the International Meeting on Advanced Spine Techniques in Canada. He has done the operation on about 70 patients, including Bonnie.
I feel just like a new person. I mean, I feel 30 years younger than I did before I had that surgery. And my husband thinks he thinks he got his wife back. I think I got my life back.
It has been 8 months since the surgery, and Bonnie is pain-free and enjoying life again. While it has been 20 years since she coached gymnastics, she can now jump right back in like it was yesterday. She says it's a miracle and is so thankful for Dr. Sweet.
I'm blessed and grateful.
Well, I'm joined live now with Dr. Sweet and Bonnie. How are you guys? Thank you both for joining me. That was just such a wonderful video. I said all of the footage. You said that was shot by a college student.
Yes.
That was wonderful. And Bonnie, I mean, your story, I think a lot of people can probably relate to the type of pain you were in. Tell me about how your back pain started. I mean, when did it come and where did it come from?
It's probably been coming on for maybe 15 years, just gradually, and I never had stenosis. I mean, I didn't have scoliosis when I was younger. It was something that just came on with age. Once the deterioration started, it started going fast. I'd been told by doctors over the years, just wait as long as you can. And I waited way too long. So, but once I was, realized that I needed to get help, I started looking for doctors, not realizing that right here in Rockford, we had the best available.
Of course, the Rockford Spine Center. I mean, Dr. Sweet, you came to the rescue. You talk about your new surgery, TFAR, and I'm going to try and say this right, Transforaminal Anterior Release. Is that correct? Tell us about this. I mean, of course, we saw in the video, you're talking about the spine, separating it. Tell me what's so unique about this and how it got discovered.
Right. Well, all discoveries are incremental improvements on known techniques, and that's what this is. There's a small subset of surgeons that work with very complex spinal deformities like Bonnie has, not many in the country, and the procedure of choice is very high risk, high blood loss, high neurologic injury, and I do those procedures and was just struggling with some of the difficulties that are inherent to that very complex high-risk procedure. And so I started adapting and developing another type of procedure called a TLIF. It's a very common way to do a spinal fusion surgery and figure out a way to basically cut the spine in two parts so that we could mobilize it and get the correction we need, and do it with a lot less blood loss and a lot lower neurologic risk. And it seemed to work out really well. So over the last 8 to 9 years, we've done a lot of these, and we are getting ready to publish a study on them that shows that it works really well. And so comparatively, the nice thing about it is the blood loss is so low and the neurologic risk, it's so safe that our patients don't have to go to intensive care units. They're in and out of the hospital very quickly, and we get really nice corrections with them.
I mean, obviously, Bonnie, you walked in here. I mean, I could have you get up and walk and show people just how well you're doing. You were in a wheelchair. I mean, what has it been like for you? What was the surgery like? And now after, how is life different?
Well, for 2 months prior to the surgery, I had 2 shifts of daycare or caregivers. I could not even stand to make a bowl of cereal for myself. So I went from quickly from walking to a walker to a wheelchair. And then I could be in a recliner or in bed, and that's the only thing I could do without pain. So, you know, it really became quite serious. After the surgery, I went 2 weeks to Van Meter Rehab Center, and they totally prepared me to go home. But when I went home, I also had caregivers for a while. And at the 2-month point, I was able to do everything I had ever done before, as far as getting groceries, cooking, laundry, taking care of my house in whatever way I had done before. I thought it was a miracle.
It is a miracle. And it's got to be so fulfilling to you to see, you know, this innovation, how it's changing the way spine surgeries are looked at, because a lot of people think spine surgery, I mean, this could change the way I live my life, but in Bonnie's situation, it's really enhanced the way she lives her life.
Right. Absolutely. You know, providing surgical care of this caliber requires really keen dedication to details, the right indications, selecting the right patient, and then applying, you know, the surgery technically well. And if you do that, you get really good outcomes, but it requires academic rigor to select the right patients and do the right surgery.
Of course. We're going to take a quick break, but afterwards we're going to hear more from Bonnie and Dr.